This is Part 3, Chapter 10, Diseases and Conditions of the Circulatory System. And I'm going to begin with a description of primary polycythemia. The primary polycythemia is an abnormal increase in the amount of hemoglobin, the red blood cell count, or the hematocrit. There is hyperactivity of the red bone marrow, resulting in this excess of erythrocytes, or again, what erythrocytes are made of, the hemoglobin. The total red blood cell mass is increased, so the person literally has more blood than they should flowing through their bloodstream. With this elevated red blood cell count, there's an increase in blood pressure, and there's an increase in the workload on the heart. Because of the increased blood mass, red blood cell mass, the blood flow in general is reduced. The person's blood is thicker. There's more blood there. It's an increased viscosity, and therefore there's an increased tendency to form clots. The symptoms of the polycythemia are related to that increase in the red blood cell number. The person will experience headaches, dyspnea, irritability, a mental sluggishness, dizziness, maybe even syncope, which is fainting or passing out, night sweats, weight loss. They'll have extremely bloodshot eyes and even a purplish appearance to their skin. The treatment for the polycythemia is to decrease the blood volume, to let some blood out, to perform a phlebotomy and remove some of the blood. But that's a temporary treatment, because whatever is causing this increase in red blood cell number is going to continue to increase and produce more red blood cells. And the phlebotomy is only a temporary fix. A more long-term treatment would be the myelosuppression, which would be suppression of the bone marrow production of the red blood cells. But with myelosuppression comes also immune system suppression and other complications. All right, next we're going to look at leukemia. We're going to skip the thrombocytopenia and look at leukemia, which is a cancer of hematopoietic tissues. Those are the tissues that produce blood. The tissues that produce blood produce the white blood cells. The tissues include bone marrow and the lymphatic tissue. Now take a look at what I'm saying is the normal white blood cell count, 7,000 to 9,000. In leukemia, the count may be higher than 200,000, and it's a sustained increase in the number of white blood cells. Your bone marrow is responsible for producing all of the bone blood cells. A person that has leukemia, depending on the type of leukemia, the patient, the treatment choice of the physician may choose to perform a bone marrow transplant, where they remove bone marrow from the donor and then place the bone marrow into the recipient. Take a look in your book at the different types of leukemia, beginning with the acute lymphocytic leukemia, abbreviated ALL. In this type of leukemia, immature and ineffective lymphoblasts, those are the immature lymphocytes, the lymphoblast. There's a proliferation of immature and ineffective lymphoblasts. This is the form seen most commonly in children. The onset is sudden. Here are some of the signs and symptoms, including a paleness, bone pain, sore throat, fatigue, night sweats, weakness, bleeding of the oral mucosa, bruising tendency, and recurring infections because of the problem with ineffective lymphocytes. Treatment is aggressive chemotherapy and perhaps also the bone marrow transplant as well. Now looking at the chronic lymphocytic leukemia, abbreviated CLL. This is more of a slowly progressive form. When a person has chronic lymphocytic leukemia, they have an abnormal number of immature lymphocytes, and this is the type that occurs later in life and again follows that slow progressive course. Some of the same signs and symptoms: weight loss, possible fever, enlarged lymph nodes, splenomegaly, the spleen enlarges, they'll have anemia, and again an increased susceptibility to infection. Chemotherapy, radiation are used to treat the condition and try to control the symptoms there of the lymphocytic leukemia. If you look in your book under treatment, they even point out that treatment is often withheld until the patient becomes very symptomatic. Because this is a slowly progressing condition that usually occurs later in life, the physicians know that the treatment is going to cause many side effects that are going to interfere with quality of life, so they'll kind of put off the treatment until it's inevitable to try to control the symptoms. Now, the acute myelogenous leukemia, also called acute myelocytic leukemia, AML. There are immature granulocytes that predominate in this type. Immature granulocytes predominate with platelets and erythrocytes, the number being diminished of those blood clotting cells and red blood cells. This is the most common form of the non-lymphocytic type of leukemia. Some of the same signs and symptoms with the fatigue and the weakness and the fever, the anemia, the paleness, headache, bone pain. Some of the same symptoms are seen in the acute myelogenous leukemia as seen in the acute lymphocytic leukemia. There's usually a rapid progression of the acute myelogenous leukemia, and certainly chemotherapy is going to be needed to control this aggressive form of leukemia. This is the most common adult leukemia, and it's also pretty common in children also, even though the acute lymphocytic leukemia is more common in the children. And then the chronic myelogenous leukemia, also called chronic myelocytic leukemia, CML. Both mature and immature granulocytes are present, so this is a more slowly progressive illness because the person still has mature granulocytes that are functioning within the body. The patient can live for many years without life-threatening problems. When they do start having signs and symptoms, some of the same that you see with the other forms of leukemia, with the fatigue, the weight loss, the joint pain, unusual bleeding, bruising, fever, and enlargement of lymph nodes. Again, chemotherapy would be the treatment for the chronic myelocytic leukemia. Okay, now look at lymphatic diseases, and the first to look at there is lymphedema, an abnormal collection of lymph, usually in the extremities like the arms and the legs. And this is a pretty extreme case of it, seen in the right of your screen with a very enlarged leg and foot. You can see the comparison in this person between the arm that is not affected by the lymphedema and the arm that is affected by the lymphedema. A lot of different causes for the lymphedema. Infection may cause this. Neoplasms, the new growths in the body, may be cancerous. Blood clots can cause lymphedema. Allergic reactions, trauma, and either certain complications of surgery. If left untreated, the lymphedema is going to result in a permanent loss of the elasticity of the tissues. Treatment's going to include elevation of the affected limb, elastic bandages to try to compress the area and reduce that swelling, that edema, diuretics to get the fluid off, and possibly even surgery if something is truly putting pressure and obstructing that lymphatic vessel. Okay, look at lymphoma now. Lymphomas are malignant neoplasms that arise from uncontrolled proliferation of the cellular components of the lymph system. This is cancer of the lymphatic tissue. There are studies being performed, research being performed to discover the true connection between certain viruses and the occurrence of lymphoma. There are several different forms of lymphoma. All forms will result in an impairment of the immune system, and the forms are identified by the different cell types that are seen in microscopic review. Look at Hodgkin's disease. Hodgkin's is the most common type of lymphoma. Tumors arise in the tissue of the lymph nodes and then spread to other lymph nodes, spread to the spleen, spread to the liver, the bone marrow. Initial signs and symptoms of the Hodgkin's lymphoma are painless enlargements of lymph nodes in the neck or the mediastinum, fatigue. Interesting comment here in your book about alcohol-induced pain and pruritus, itching. As the disease progresses, the patient begins to experience symptoms of fever, night sweats, and weight loss. So the lymphomas are divided in the Hodgkin's disease lymphomas, and then others are referred to as non-Hodgkin's lymphomas. Most of the lymphomas respond good to chemotherapy and radiation, but that's only if they are discovered early, treated early, do they have the good results there. Okay, now moving to looking at transfusion incompatibility reactions. This is what happens when a person receives the wrong blood type. In a different class, terminology or anatomy and physiology, you should have learned about the different blood types and how important it is that if a person is a caregiver, like a nurse, that's going to administer blood, that they have totally tested the person's blood and the blood to be given to be sure that the types match. In the transfusion incompatibility reaction, there's an anaphylactic shock reaction when the person receives the wrong type of blood, when they receive large quantities of antigens, when large numbers of antibodies are present. The blood types work on a basis of antigens and antibody reactions. For instance, a person with type A blood has type A antigens on the red cells, and they have antibodies against type B. So if they receive type B transfusion, the antigens and antibodies will interact. The reaction causes hemolysis, which is destruction of the red blood cells, or agglutination, which is a clumping of blood cells. Signs and symptoms: chills, fever, tachycardia, the person's heart will race, severe back pain, vomiting, diarrhea, hives or rash, substernal tightness, and dyspnea. As the reaction worsens, the patient's blood pressure bottoms out. They become very hypotensive, low blood pressure. Bleeding begins to occur at the puncture site. Blood starts showing up in the urine, and eventually renal failure is going to occur because of this systemic reaction to the wrong type of blood. When a person's in a caregiver position to administer blood, they have to follow a very careful plan, a very careful protocol as far as being sure the exact type of blood is given to exactly the correct patient. collection of vital signs before the blood is given, during the transfusion. Monitoring is so important, and then after the procedure also. Prevention is the best form of treatment for transfusion reactions. Let's look at hemophilia now, which you may have heard of a person being referred to as a hemophiliac that has this condition in which they have an inability to form blood clots. If you remember from your anatomy again, or the medical terminology class maybe, that a person forms blood clots because of an interaction of several different cell types, proteins, factors, and if any part of that, any component is missing, then the person's not going to form the blood clots properly. The most common form of hemophilia involves a deficiency of clotting factor 8. And this is called classic hemophilia, and truly only males develop the classic hemophilia. Females may be carriers of the genetic defect, but it's the males that are truly affected. As far as a cure, there is no cure for the hemophilia. It's something that's built in the person's genetics, but there's certainly treatment with factor 8 that's necessary to stop bleeding when it occurs. Transfusions may also be necessary according to the amount of blood that a person has lost. This is the last, I'm going to go back to hemophilia there. This is the last of the conditions to talk about in Chapter 10. Again, with the hemophilia, I said the most common, the classic hemophilia, only affects males, but there are certainly other types of hemophilia that can affect females. They're just not as common. This concludes Chapter 10.